Hello, everyone. Welcome. I'll just pause a moment as we allow everyone into the room. So happy to have everyone here. We are going to have a wonderful program tonight, just letting more folks in. We have so many musicians in the house. It's exciting. Anyway, I'm Lisa Martin with Silver Spring Town Center, and welcome to Arts and Health, transforming the healthcare experience through the arts. Before we get started, I have a couple announcements. SSTCI, as you know, is a nonprofit arts organization in the Silver Spring Civic Building, and we present over 100 free arts and entertainment programs and events throughout the year, including the Silver Spring Blues Festival during normal times and outdoor performances on the plaza. And Wendy Laxner is the host for tonight. And we always, in normal times, look forward to hosting Wendy and the Lost Boys on the plaza. So hopefully we'll be able to be doing that soon again. But we are completely virtual through this time on Zoom, and we are actually doing well over 100, about 130. All of our events are made possible with generous support from Montgomery County, United Therapeutics, the Arts and Humanities of Montgomery County, Maryland State Arts, Montgomery College, and many others, including this month's sponsor, Buzz 365 Media. And now I'd like to introduce our host, who many of you know and love through her wonderful music. Wendy Laxner is a Washington area musician, teacher, composer, and arts and health practitioner. In addition to her work at Johns Hopkins, she provides educational programming through several agencies, including Washington Performing Arts and Arts for the Aging, working with children, seniors, and adults with developmental disabilities. She received her master's in music education from the University of Florida. And you can learn more about Wendy at wendylanxner.com. And now let's pass the mic on to our host for the evening, Wendy Lanxner. Take it away.
Thank you so much, Lisa. Thank you for having us. I'm really looking forward to tonight. We have some wonderful panelists with us, and I'm going to let them each introduce themselves. But we have a visual artist, we have musicians with us, and I thought I would start tonight by just giving a brief overview of arts and health. And then you're going to meet the panelists. We have some discussion points we're going to talk about. And we're going to share some resources with you, ways that you can use the arts for your own well-being. And then we're going to open it up at the end for a Q&A. So, and we'll probably mostly be using the chat for that. So feel free to just put things in the chat as we go along if you think of questions you want to ask. So I thought I would start by showing just a few slides about arts and health. So I'm going to share my screen with you. Okay, so what is arts and health exactly? Well, it's a field dedicated to using the power of the arts to enhance health and well-being in diverse institutional and community contexts. And there have been recently, in 2019, there was a huge study of all the research that's been done supporting arts in health programs. There are over 3,000 studies showing that arts promote health and well-being. And programs are in over 50% of the hospitals. Just around here in the Washington area, off the top of my head, there's a program at Walter Reed, Children's National Medical Center, Georgetown University Hospital, and I'm musician in residence at Johns Hopkins Children's Center. So those are some of the many programs locally. And here I have this statement from the National Organization of Arts and Health, which is a fairly new organization, actually. It's a really growing field right now. It's kind of exploding. And this really sums it up well, I think, that arts and health integrates literary, performing, visual arts, architecture, and other forms of creative expression into a variety of healthcare and community settings to enhance health and well-being. And so in my case, I'm a musician, but I'm not a music therapist. And I thought it might be useful to look at this a little diagram here showing. So music medicine is when people use music listening for health promotion. Music therapy is used for, it's based on diagnosis. It's a use of various methods of music within a therapeutic relationship. And that kind of music intervention is provided by a credentialed music therapist. And then I'm in the other category, okay? So other uses of music activities for health promoting or recreational goals. So that's me, I'm the other. And I love this statement by the president of Musique et Santé in France. When we address the child, we speak to his or her part, which is not sick, the part which wants to live and to grow up in spite of the illness. So here's someone from a Scottish group actually singing to a patient. And my focus is pediatrics, so I'm sure you're getting a sense of that right now. And I just wanted to point out the differences again between music therapy and being an arts and health music practitioner. So everything I do, I'm trying to empower the patient. It's really in the moment. It's not based on a clinical diagnosis. I don't have a therapeutic goal with the patient other than just to provide fun, distraction, the benefits that come from music playing and learning. And some of these benefits are here. And I love this picture. This is, I work as part of what's called the Child Life Specialist team at Hopkins. Child Life Specialists attend to the non-medical needs of kids. And this is one of my favorite Child Life Specialists over here, Chrissy, playing on my xylophone off my music cart with this patient who agreed to be photographed. And he's playing a drum set. It's like an e-drum set. Anyway, I'm hoping that this overview also gives you a sense of the kind of work that I'm doing. And so there's also the one aspect of the work that I do is teaching. When people want to learn things, I teach them. You know, I might give somebody a ukulele lesson, and there's a lot of benefits to teaching. Teaching contributes to kids' growth. It normalizes the weirdness of a hospital. And, you know, when you're playing and learning, you don't have space in your brain to be anxious. It really is true that your brain can't do both of those things at the same time. So it really does reduce anxiety. And then here are some of the things that can happen in the healthcare setting. So this is a picture of my music cart. So I'm at Hopkins every Friday, and I go around to the units and play music, and I do a lot of instrument cleaning in between. And these are some of the instruments that I use. So these are some of the things that you do as an arts and health practitioner. You know, through your work, you're creating community, you're sharing in your humanity with the people that you're working with. You may be giving them new ways to interact or new things that they can do to enhance their own lives, create some joy, some healing, and just foster overall health and well-being. So in addition to the work that I do at Hopkins, I also teach, and I music direct for a theater company made up of adults with disabilities through an organization locally called Arts and everything's virtual now. So anyway, that was very long-winded. So now, hang on. I'd like to introduce Steve Boucher, who works as a volunteer with Musicians on Call. And I'm just going to start again by sharing my screen. He asked me to share this video with you. So There he is. Hi, Steve. All right,
Hey.
here we go. Here's the video. Yeah, Musicians on Call. Woo! I also volunteer with them too. So, let's see. Here we go.
Hospitals are not happy places. It's sterile and it's cold. So anything that anybody can do to help warm that up is amazing. Music is this wonderful tool that can change and shape your day, your mood, your memories. And because of those reasons, there was no choice but to bring this into the people who needed it most. So the mission of Musicians on Call is to bring musicians into the hospitals and nursing homes and hospice and walk them room to room to play right at the bedsides of patients.
So when we're in the hospital, we're seeing patients fight every day, and we're seeing their families, show strength every single day. And when our volunteers, musicians and guides go into the hospital, they're part of that same fight. They're fighting to make people's lives better.
And there's something about the live music experience that is different than what's coming out of the speaker of the TV or the speaker on your bed. There's something palpable in the room that you can't describe. It's really frustrating because describing what we do, playing for a patient, I say it, you picture it, it's really easy to get, except you actually don't get it until you're in the room because something happens, something kinetically just changes. It's really indescribable.
The beauty of Musicians on Call is we bring a completely different energy to the hospital. We bring excitement, we bring happiness and joy, and ultimately healing to the hospitals. And not just the patients, but to their families and the caregivers as well. Even if it's just for a minute or a few seconds, you can tell that everyone's forgotten where they're at. And to me, that's one of my favorite moments in the hospital.
In life, it doesn't take heroes to make a difference. It doesn't take changing your life to make a difference. You can just choose to make a difference in big ways and in small ways. And getting out and sharing your stories and your ways of help and the ways you need help and the ways you can help is a really amazing way to impact both yourself and other people.
Thanks, Wendy. I appreciate it. So, Musicians on Call, thank you. I'm Steve Boucher, and with Musicians on Call for a few years now. And I would say I play in taverns and restaurants and local clubs in the Annapolis and Eastern Shore areas. And I can tell you that my volunteer work with Musicians on Call is 10 times the value of anything else I do. So everybody needs to find their own way to give back, but that's how I do it, through music. And we'll talk more about it, but I also was invited from Wendy to go out to Hopkins about a year and a half ago, and that was a memorable experience I'll never forget, helping a young gentleman that had serious cancer learn music and learn how to play the guitar. That was his one wish. And those kind of things, they just inspire, and they're very fulfilling, in helping others is where everybody really needs to help folks. Love and caring through music is what's worked for me. And I strongly believe in the healing power of music. So I'll keep it moving, but I appreciate being here tonight and sharing the Musicians on Call story. Thank you.
Thank you so much, Steve. And I met Steve because I've also done volunteering through Musicians on Call. And, we've all had to adapt to the pandemic in different ways. We're going to talk about that later. But now I would like to introduce our next panelist Marcie Wolf-Hubbard.
Hi, everyone. Thanks for inviting me, Wendy. And I was going to talk a little bit about how I work in visual arts. I work with seniors, I work with youth, youth who may have mental health struggles. And that is a wraparound program, actually. And like Wendy says, I'm not a therapist. And it used to be a lot of times when I would come, also, the seniors and including seniors with dementia. And I'll probably jump around because my head is that way. But Wendy and I both are artists, teaching artists with Arts for the Aging. And I've gotten to know Wendy a little bit more recently. So I guess when I work with anyone with different populations, seniors, adults, children, I'm always focusing on the art and skill building and the positives. Anyway, I guess just to talk a little bit also about my background, I think Karen and I were in the same program with Artists in Healthcare back in 2005 with Dr. Judy Rollins. And it was how to work with your discipline in healthcare settings. And that was great. That's when I started working with seniors with dementia, actually Arden Courts over in Kensington. And we had a pilot program, plus we would meet regularly. So it seemed like a long time ago. But anyway, I kept at that. And but maybe I'm not thinking clearly because I'm more thinking of now. And I'm fortunate because I'm able to work online and have classes and have wonderful students that show up. And again, focusing on improving our skills. And it feels like an arts community. And I think the art is what has kept us together. Some of my students say it's like keeping us sane. And maybe I'm already starting to answer some of those questions that you came up with. But anyway, briefly, my background is also in commercial art and illustration. And at one point I was a courtroom illustrator. And anyway, I love sharing my love of art. So I have other things to show, other visuals, and work for my students also, which I can do sometime. And happy to answer questions later too.
Well, can you show us a piece of art or two right now? I'd love to see something.
Sure. Okay. So I have also other things because I know that some of you have shown when you've worked in the hospital settings or whatever. And I just kind of queued up a little bit of this clip that I recently finished a series with Chris Brown, we collaborated, did an arts and music cafe. And this is just a couple minutes from that. Oh yeah. Right. That's reminding me of spring, but that's just me. Okay.
That's good.
That's
Oh wow! And this is a peek of a drawing of a musician. This is cool. Here's Chris. I might decide to cut this up or cut out shapes like Sam Gilliam did, or maybe take some papers and collage over this. Oh, that's really nice. Oh, cool. Okay.
Oh.
And another one, page 2.
All right.
I'll make it darker. No, they
We've
talked
been
about
having so much fun. Can you believe it's already noon already?
Wow, noon
Wow.
05.
Noon 05.
Well, that was one thing. And then I just brought up a couple different things, and just with the pandemic, it seemed like this was a good project to have. Here, I'm going to switch over to this. This is my students' work, and my work is in here. But we did building tiny houses with, and also Lisa was in a recent class with that we did also. But anyway, with mixed media, some are with children, and I'll just kind of go through this. This was the summer tour. And here it started off with the children. Can you see that with the children?
Yes, yes.
Okay. So the children's were kind of like art camps. It was like one session, and they were just building. And then some of my adults, the adult classes, were working over, I guess, 4 sessions. And paper mache. This woman came in from Seattle, which was cool. Molly has not stopped building houses for like 2 years. Kim also had done a COVID house. Karen's involves a canoe. This was one of mine. And then I also have this tiny house related to COVID, 2 of them. I built this for my friend. I built a house. Well, that's one. And then I'll share a little bit. This is I did have like a mixed media excursion, mixed media and tiny house, and I'll show you my work too. So, okay, can you all see this?
Yes.
You see the first slide? Okay,
I love the idea of going on an excursion during quarantine.
Right, right. And we recently did an art happy hour, which lasted 3.5 hours, which was a lot of fun. Amy was there. She's, draws. Here we go. So just this is including the mixed media. And Kim is an entomologist, I would say. So these were images that students had been working on. And I don't know if Elizabeth is here. This was her house. Sometimes she's at that session. So one more is, oh, okay, and that's mine. Recent house. Okay, it's one of my students. But then I quickly, just if you want to see the work that I do, and I kind of like just put this together so you could see how I started working during the pandemic. I started off with, oh yeah, it's spring, right, everyone? And then I was
a whole year ago.
I know. And then I was working, I really got interested in painting or drawing from Barbie doll dresses, old vintage maybe, and maybe think of it simpler times. So I did some of those. And just collage drawing. This one is called Found, and it's kind of like things that we may find at the park, and you'll see Rock Creek Park is like a favorite place. So kind of feeling like I have a connection with the bird and the nest and objects. There's my Rock Creek Park house and a redaction house. I got into redaction, crossing out, and I did that with projects with the adults and also with the seniors, and we came up with heart kits, which would go to seniors in the nursing home, and they had the instructions with Arts for the Aging. We packed that up, and they were able to do this independently. Also, fortunately, as a visual artist, I could draw life drawing on Zoom locally, DC Art Models Collective, and an international group, which it's really cool. You're drawing with people all over the world. In the UK, they have it. Here's the redaction and working on my altered book, which I'm like, I can show you, it's very thick by now, more redaction, altering the book. It's just more flowers. more lately, some mixed media. So this is the kind of work that I do with the students as well. And I think the students really have kept me going during this time. That's with wax and caustic, starting with the drawing and charcoal. There. Okay. I think I showed you everything.
Wow, thank you so much. This is amazing. I felt like I just did some art, just looking at all that art. It's really, it has such a nice effect. Like, I don't usually give myself time to do it, but I'm always so grateful. So, all right. Well, Karen Ashbrook, can you introduce yourself? This is the last of our panelists.
Yeah. So I have been a hammer dulcimer player. Are you going to spotlight me, Wendy? Can you do that? I wonder if I can spotlight myself. I can spotlight myself because I'm a co-host.
Okay, it's too slow.
Yay, do it.
That's very funny. This is a hammered dulcimer, if you don't know what it is. And I've been playing them since the mid-70s. I built one in high school. I lived overseas for 5 years, a couple years in Europe, a few years in Asia, and have mostly played traditional folk music, lots of Irish, lots of Celtic, but old-timey Appalachian, English. And then I married a Belgian, and I started doing more European music because I married a Belgian who's a wonderful musician, Paul Orts. But let's see how long. In 2013, I guess in 2012, I ran into a program called Music for Healing and Transitions program, which trains musicians to play for one-on-one at the bedside for people through all stages, all patient conditions, through actively dying. And took the program, became certified. So my scope of practice as a certified music practitioner is quite narrow. It's one-on-one playing at the bedside, but it's the polar opposite of performing. It's not a performance. My job, I'm like wallpaper. I create a sonic healing environment. That's what I call it. And a successful day for me often involves helping people get to sleep. That's a big one, helping people get to sleep, helping them cry. I'm sure all of the other musicians have had, and artist Marcie too has probably had that experience because it's such an intense environment. But yeah, it's definitely different. I have 2 hospitals I'm in theory currently working at, although one of them, Walter Reed Medical Center, the military hospital, I have not been at since March of last year, except for a few special dedications. But I'm also very actively involved at Georgetown through the Arts and Humanities program at Lombardi. I'm one of their artists in residence, but we service the whole hospital, including the staff. And since lockdown, that for us has meant we put out a free weekly newsletter with arts activities, movement, creative writing. We offer classes. And I play for patients via Zoom. So, and I'm going to just quickly share my screen and just show you a couple of, wait a minute, I got to change, a couple of photos from Georgetown. So a lot of where I play in critical care. Playing for people actively dying at the hospital, definitely. ICU, the ICUs. But I also play, here's one where I'm in with all the staff there. I'm in the post-surgery unit, and the staff really likes the music, and especially folks in the PACUs in the post-surgery unit, because it's sort of, they have to be ready for anything to happen at any time. But it also can be a little tedious, so they have to always be on their best. And I'm going to just give you a little sample of what it sounds like, the kind of stuff I do. If it makes you sleepy, that's about right. That's a lot of what I do. in, I observe the patients, I adjust. Even people who are non-responsive, intubated, in comas, have ways of communicating and very much respond to the music and all. I have a story from Walter Reed. So at Walter Reed, I'm part of a program called the Stages of Healing that brings music into the hospital. And I do one-on-one work, but I also play in the lobby and the post-surgery units there. And I was doing some lobby work, and it's not uncommon for people to tell me they plan their appointments around when they know I'm going to be there, because I help them enter the hospital and reduce the tension from having driven in our traffic, which is notoriously bad. But one day I was playing, and when I finished playing, somebody who was active duty came and sat down, and he did what everybody does. He pulled out his phone. That's what they all do. And you don't know if they are texting or surfing the web or recording you. All those things are quite common. But when I finished, he said, I have to tell you, I did not know you were going to be here today. I have no idea what that instrument is you're playing, but I've been on 5 tours of duty. I've been to Iraq. I've been to Afghanistan. And in all that time, this is the first time I remembered to sit down and appreciate beauty. And, I feel like what the arts do, what the music does, is it brings beauty into people's lives again. When you're working with people who have serious health conditions, and maybe they've been in the hospital a long time, the world is very bleak to them. And it's not uncommon for music to make them realize they can still appreciate beauty and engage in life in a way. And it really brings them comfort. It's a non-pharmaceutical way, which is super important for people to relax. I feel like the doctors do what they can do. The chaplain comes in maybe and does what he can do. The medicine does so much, but sometimes that's not enough. And the music goes in deeper. There's a point where everybody's done what they can do and the patient is still struggling and suffering. And the music can just get right into that space that helps all the other therapies and modalities are doing be more effective, helps them release and relax. They might be really angry because they didn't like the way somebody talked to them, or their bell wasn't being answered fast enough. And again, it dissipates anger. I've seen that happen many times for staff as well. I had a charge nurse tell me one day after I started playing, she said, and it was a day where not a lot was happening. And I thought, I'm wasting my time in this unit. I should go somewhere else. But I played a while. When I was done, she said, I'm so glad you came. I was ready to bite someone's head off. This was the charge nurse. She said, and as soon as you started playing, I could just let go of it all and do my job. So, I think that's what I do. And as Steve said, and I know we have all, those of us who work with people in healthcare settings have experienced this. It's the most gratifying work in the world. I feel like I have the best job in the world. Nothing comes close to comparing how uplifting, and I feel like I'm in the presence of grace. The miracles I see, the transformations I see from music. And I don't feel like it's me. I really feel it's the medium. You just let it do its thing, and it's extremely effective. So I will pass it back to Wendy.
Thank you so much, Karen. You covered so much of the heart of what's in this practice, really. And, I think that more and more the other care team members are acknowledging what a huge difference it makes. I mean, like you said, both to the patients and the staff. One thing that I've noticed on the units at Hopkins is all these different functions it serves. I mean, it models for parents. I mean, there've been lots of times when I've gone down the hallway and then I hear them continuing, like, oh, they've been bored out of their mind for hours and now they have a new thing they can do together, or you know, a procedure is about to happen, or you know, or it just did, and the music is like this way to kind of transition. And yeah, I've done a little bit with staff. I'd love to hear you talk a little bit more about that, about what you offer to staff. That's been a real focus in the arts and health world recently, is we need to take care of these healthcare workers, right?
Oh, and it's, you know, in a way, I find it really heartbreaking. I'm not in the hospital this last year because the staff needs it more than anybody. But I will say, I once had a nurse say to me, and again, it was a charge nurse in a critical care unit, in an ICU unit. When I showed up, she said, "Oh, good, the music's here." The unit always functions better when music's here. People are nicer, you know, and she meant everybody, the staff, the caregivers and family, the patients are nicer to each other because it takes the tension off, and it changes, it humanizes the hospital. I feel that super, you know, and that the music on call video touched on that as well, that they're so busy in the hospital taking care of your physical body, and they don't always have the time to take care of the whole person, the soul, the heart. And the arts in all the different forms humanize the hospital for the staff and for the, you know, the people who are there.
Absolutely. And you know, so we're going to move into some of this discussion, as we already are, right? So I just put together a few questions. The first of which is, you know, if we can continue to think about the ways which art programs transform healthcare. I mean, we're kind of talking about that right now, but Marcie, do you have any other thoughts about that? Like with seniors in nursing homes, I mean, that's primarily the context for you, right?
Right, but even with
Or with
my students, my day-to-day, you know, and I'm just listening to Karen. I guess I just thought music, music, but art is transforming, and it's maybe they get into another space, and that I think is what's great about it. So, and I guess that was a question. How does work transform? How does this work transform? Well, it's transforming. That maybe doesn't tell you. But some things I kind of jotted down just so I remember. It just alleviates stress, and by putting the focus on art. And Karen and Wendy, I guess you were talking about staff, and I was just thinking there was a staff member at one of the recent with Arts for the Aging Zooms, and for two of the times at the end, I guess, I don't know, maybe he was a board member, I'm not sure, but it was finished and he's like, I feel like I just had a massage. Well, there was the art and the music and just getting into that space, you know. So, and I got really, really nice email from people just today. Someone was saying how she thought she was going to give it up making art. And just after, I guess it was yesterday's session, I work with Smithsonian and also Glen Echo Park and Yellow Barn. And this was one of those, the Smithsonian students, and it was just tonight. So we'll just say, I was so pleased with the positive reception of my crow collage. It's the first time in a very long time that I received so much positivity directed at my work, at my artwork. I truly had been wondering if it was time to just give up on art, not since your class, but for a long time. And I do not give up on something I loved easily. She's just grateful. She was so grateful to you in the class for all this encouragement. I feel more confident now. I'm feeling so much more positive again about pursuing art. So thank you again. And anyway, I don't know if I was going to say anything else, but especially now during the pandemic, it just feels like we all need each other. And the art is a great place for it.
Right. I mean, the sort of getting an affirmation, right, of yourself or your work and connecting with other people. And no, it's really important in the pandemic. And one thing we were just talking, I was realizing all these organizations, like Marcie and I work with Arts for the Aging. And as one example, we went to a workshop today that was all about like self-acceptance, basically, and doing things imperfectly, and that's okay. With the idea of not only of being, this is something you can do with people that you serve, but also we were benefiting from that workshop. So they're supporting us. And I have to say, there's more and more consciousness of like taking care of the workers, in these contexts. Yeah, that was it made me feel so good about tonight, because I was like, wow, this could be like, I got to do it's okay if it doesn't go smoothly. You know what I mean?
Right.
I've never hosted a panel before. Like, it's all right.
And I have been, and I said it then, and I've been in one of the sessions that Wendy did, and it was just great. It was like a telephonic, so people did not have the internet. And they'd be on the phone. Amazing that I could dial all those numbers, and it was on Zoom. And one of my good friends that I met from working with Arts for the Aging, a senior, I think Lisa met her, Frederica, and she's just so interesting and cool. She's like, I guess she's like late 80s now. But anyway, Wendy had them singing and just talking, reminiscing. And it was just, main thing, Wendy is just really genuine. Really, I mean, she's genuine, and that everyone just had such a wonderful time. And these are seniors that are isolated and more isolated, and that was just so wonderful. So,
well, a lot of times, including then, it really feels like the music is just this vehicle for connection. Mm-hmm. That's all it is. The music or the art. It's just so we can connect as humans, one thing I wanted to talk about was how you gauge the kind of impact you're having. And you touched on that a little bit, Karen, about people who are like in a coma, but they're still responding.
Yeah.
I was wondering if you could expand on that a little bit.
I can. So I'm going to share my screen. I'll tell a story. I actually played for several months for a Parkinson's patient, and I knew he really loved music, but the point at which I started playing for him, he could not control most of his movements. He couldn't talk at all. He was clearly visibly aware because he would watch me play, but I didn't know if he liked what the music I was choosing or not. I knew he liked classical music, so I tried to do it. And after I'd been playing for him for about, 6 weeks. And at the end, we're trained to have a protocol, whether the person looks like they're conscious or not. We do a very simple introduction and ask permission or explain we're going to just play gentle music. They don't have to do anything. And at the end, we thank them. And you'd be surprised how many times, especially when someone's dying and you think they're not registering anything or they don't have much energy, when you address them directly, they respond because they have very little energy. But anyway, after about 6 weeks of playing for this person, at the end of one of my sessions, when I said yet again, I really hope you like my music, I can see you're listening to it, and little tiny crick of the smile went up, right? Little tiny. And so after that, each week he would respond a little more with his eyes too. And he couldn't nod, he couldn't lift a finger. And I was talking with the staff. I said, so, he has a way to communicate. And they said, oh yeah, he has. And I played for him just a couple days before he died. And I hadn't seen him for a few weeks because he was moving around the hospital into isolation. And it took me a while to get to him. But anyway, this last day I came and played for him. It was about 2 days before he died. as soon as I walked into the room, his whole being and face lit up, like he just beamed as much as he was able to. He, I mean, it was so odd. He was so happy to see me. And, you just learn one of the first things you learn is really small gestures make a difference. But you can see people breathing, you see if their face relaxes. Obviously, if they fall asleep, it's working. So I'm going to just quickly share my screen and show. At Walter Reed, they have comment cards out in the lobby. When I play in the lobby, actually, some of these were from the psychiatric unit too. And one of the things I love about these different comment cards is, and these are just a few of them, is the variety of writing. And you can just by looking at them, you just see there's such different personalities. But the common theme is this was actually, can you come every day? I'm so relaxed. That was from someone that was from a social worker who was working in the post-surgery unit, So you just, comment cards. I've been at hospitals where they did do surveys where they either with staff at Georgetown. One time we did one with the nurses in the PACU, or with patients before and after, where they asked people just a very simple survey. How did you feel before? How did you feel during the music? How did you feel after? And unfortunately, a lot of the patients I play for the most in the hospital are not capable of. I mean, my most successful sessions end with the patient falling asleep. So they're not able necessarily, but they speak with their bodies and they speak with their energy, and so you just learn to take subtle cues are huge cues. And then if they have a caregiver with them or a family member, sometimes the family member will tell you, wow, I can see how much they've changed. I mean, when I first started doing this, it took me a while to know that, but someone would say, I can't believe the difference. And then when people are just really ill, the tiniest difference is huge. Babies in the NICU, you'll see the heart rates go down, they calm down a little. Oxygen rates go up. If patients on our monitors, you can see from the monitors the difference too.
Yes, absolutely. I've seen that. In fact, I was playing for a little boy in the NICU, by the way, is the neonatal intensive care unit. And I played a couple of songs in the key of C, and this nurse and this child life specialist were there. And then for some random reason, I started playing in a different key. It was really obvious that he didn't like it. It was like, whoa, he doesn't like G.
Too.
No. Go back to the key of C.
And that's why you have to watch who you're playing for, because you will have surprising reactions, even when they're not conscious.
I know. And this kid was so young. I mean, he was like this big. But anyway, Steve, I was wondering if you had any experiences that you could share about your feeling about the impact of what you were doing through Musicians on Call.
Sure. Switch over to me, I guess. Let's see. I got to do something. You all see me all right? Let's see. Yeah, so what I'll say is that, I played primarily at the VA hospitals. So in Baltimore and Washington, and I've done some senior living and of course, John Hopkins. So, so you have some situations that are very difficult to embrace while you're in there, and it can become emotional. To go back just a little bit to what we were discussing a little earlier is one thing I did probably 2-3 years ago was to spend time with the caregivers. So I would go behind the counter, I'd go in the nurse's lounge, and I would play 2 or 3 songs for them, and they would, they'd be stretching, they'd be dancing and, singing along, and, because their days are long, their feet are tired, they're doing a lot of stretching and lifting, and sometimes they were the forgotten heroes, so to speak. And so I did that from the very beginning, and it made a big difference. And then that energy just flowed right into the rooms. So with musicians on call, we have a guide that goes into the room first and introduces musicians on call and what we're about, and says that I have a musician with me, and I'd like to bring. Would it be okay if I bring Steve in to play you some music or some songs? And so I'm standing in the hallway, usually waiting, and putting on the gel and stuff like that between rooms and so on. And so I'm standing there one night, and a doctor comes up to me and he goes, "You're with Musicians on Call?" And I said, "Yes, I am, sir." And he goes, "I really need your help." I said, "Sure, how can I help?" He says, "I have a patient in room 142 that really needs the healing power of music. And they don't have anybody that lives close by, and they're really alone, and they need that." And so I said, "As soon as I'm done with this room, I'll shoot right down there." But and it was great going in there, and it was a person that had very little reaction in the past, and then all of a sudden they're starting to tap their toes under their blanket, and you get that smile at the end, like Karen mentioned. So those things, they change you, and I think in a spiritual and emotional kind of way. And if it's self-expression from dancing and singing, or the art that we saw earlier, so with Marcie. So I think it's all of those things rolled into one. And I just I'm on a different planet when I come out of these programs, because it's just so heartwarming, and they're so in tune to what's going on. And there was also, I'll give you one more, and there was another person that had not spoken in months and had been there. So the thing about the VA is, sometimes they're in there for long periods of time in recovery. And if it's PSTD or whatever, there's different wings. And I primarily when I go to those two hospitals, I play every floor, the two ICUs, everything. So, and I'll push the limits on the hours, but they're kind of waiting for me to come. So it's so this one person, all of a sudden they're moving around in their bed and they're trying to sit up. And so the guide called the nurse and said, "Hey, I think this person needs help." And they wanted to sit up, and then all of a sudden their eyes are bright, and you in with that smile, and the toes are moving and stuff, and it's like you just can't believe it. It's just and in the video that we showed earlier, it's I can talk about it 100 different ways, but you just don't experience until you're right there. If you were a fly on the wall or standing next to me or whatever, it's just this thing that takes over the room. And it's just amazing. So I'm just thrilled to hear the other stories, and really what music and art do for folks that really need these kind of things to help them get through what they're dealing with. So thank
And
you.
I do feel, for me, as you said, the music is as therapeutic for me as it is for the people and I am always a lot more relaxed at the end of a day than when I start.
And
Yeah.
how have you continued, Steve? Maybe we can move into talking a little bit about the pandemic situation. Have you continued through the pandemic to volunteer?
Yeah, so Musicians on Call kind of switched to they have what they call a pharmacy program where they provide headsets and stuff for folks. And then in addition to that, we put on a video program that runs on the patient's TV. Can you hear me, Wendy? Okay.
I can hear you, Steve. Wendy's frozen a moment.
Okay.
Must be me.
So what I have done since March is done several videos that get linked together with other musicians on call, musicians throughout the country, and then they get put into the programming as one of the channels on the TV that people can watch, and it's ongoing videos. It's kind of like a MTV for musicians on call, and so we do that. So I do this kind of Zoom thing or record myself and then upload it to YouTube or something else, and it gets pulled into a feed that goes out to healthcare facilities throughout the United States.
How about you, Karen? What have you had to do for as far as the pandemic goes?
Online, like everybody, you know. And, glad I didn't give up my day job of teaching hammer dulcimer, because I definitely just went online with that. But as far as, you know, Georgetown really, Georgetown Arts and Humanities program really jumped to. And the first thing they did was they set up a weekly email newsletter. It's free. I'll put it in when we get to sharing resources. And it has it has a music video every week and maybe a recipe, maybe some movement stuff, little interviews or expressive writing. And so the artists at Georgetown are put out this weekly one. But now we're actually playing via Zoom. The hospital got some iPads and they just got a Bluetooth speaker. Yay, finally. So the music's better. And they have what they call runners, people who set up Zoom sessions with patients. And it might be for family calls, but it's also for music now. So it's not as many hours as we were doing before. I mean, it's a fraction. But at least we're playing. I'm playing in the hospital 3 days a week again for shorter times. And then a couple of the artists are doing relaxation and stretch breaks. One with the staff, the nursing staff, just really short breaks. And the other in the inpatient psychiatric unit for staff and patients once a week, where they just project it on their screen. So we're getting into the hospital a little bit. I do know some people who've done some hospice work who were connected to facilities that let them play outside the window while the weather was still warm. Nina Falk has a program working with hospice patients, and she's actually, I think, able to play in the halls at, I don't know if it's at Casey House where she is, but so she's still been able to do some work playing for people.
And I'm a member of the Child Life staff. So because Child Life is considered essential, the only adaptation I've made is that I've started doing this weekly fun jam on the TV station. It's just live, from downstairs, because I'm not seeing any COVID patients, for example. And there was a long time there where I wasn't even seeing patients in droplet. So there's different levels of isolation. So because I wasn't seeing those patients, we decided to do a weekly fun jam. So
nice.
I'm doing one tomorrow, as a matter of fact.
A couple of the hospitals in the area have considered the musicians essential, and they've been vaccinated, and they are in the hospital, not working in COVID units, but Shock Trauma, University of Maryland in Baltimore, and the Inova Cancer Center in Virginia, Northern Virginia somewhere, is letting their musicians, at least in some areas there, and they vaccinated them. So
yes, I got vaccinated. I mean, incredible. Yeah, I know. Woo! Marcie, how about you? I know you talked a little bit about this, but what have you had to shift because of the pandemic?
Well, I was able to get started early, and I credit Walt Bartman from Yellow Barn, who got the instructors to come on Zoom regularly. We helped each other, and tech issues and stuff. So that got us all online quickly. Arts for the Aging a little later in the summer. Same with Smithsonian. But I was going to just mention a couple things. Back to some of the seniors that I work with, one thing that stuck out just about the active activity of making art, I have a friend or a friend who would come with me to volunteer, and she was a pretty good talker, conversationalist. And this was at one of the senior places, Kensington Club, where mild, moderate dementia. Talked a lot to some individuals while we were doing the art sessions. The man was talking about his history, photography, everything. Driving home with my friend, and she didn't know that they had dementia. And I just thought it was really interesting. And I talked to Colleen there, the director, another time. I said, oh, just, I wanted to let you know that. I thought that was interesting. And Colleen said something like, well, that's because they're acting like anyone else would just be participating, doing it. So it's that involvement, and they're not feeling like they can, although, I mean, maybe sometimes I can't draw, whatever, you hear that from anyone, but they were involved. So that, I thought that was interesting. Yeah, and so anyway, one place that I've worked has gone dark, totally dark, can't connect, it's a Holy Cross. It's too bad. It was medical adult day, and it's hard to even know how to reach, connect with them anyway. But so anyway, so Wendy, what was it you were asking?
Oh, just about the pandemic. And actually, it's already after 8. And in a way, I have to say, like, the pandemic has been kind of a catalyst for the generation of ways to use art to help all of us cope, because we're all debilitated by the pandemic. I mean, we're all like patients in this weird pandemic hospital, And so I have some links I want to share in the chat with people. I'll tell you what, I'll just get the ball rolling with those. And then if you guys have anything to add, it would be great. There are so many resources out there for people that are free. There's events all the time. I know I have Zoom fatigue. Like, I can't go to too many.
I do too. Yeah.
I just really, but here, I'm just going to put these things in the chat and just talk briefly about them. I have compiled resources. Oh, did anything happen? Wait a second.
And your website's wonderful. You have a page of really wonderful resources, Wendy.
That's what I was trying to share that. Let's see if no, it's not even working. Wait, I guess I have to do it one thing at a time. I think I'm trying to share too much stuff at once or something. Wait a minute. Let me see if this works. Hold on. Oh, no, it did work. Okay.
There you go.
All right, here we go. Okay, so right now there's a radiothon to benefit Johns Hopkins Children's Center. I have to put that out there.
Yay.
Hashtag for the kids. Okay, a friend of mine has a nonprofit arts organization called Carpe Diem Arts. Every day they do a sing-along at 12 noon, every day. So I have the link in there. There's a racial justice concert that's co-sponsored by Hopkins and the International Mind and Arts and Mind Lab, which is a project centered at the university at Hopkins. There's the link for that. If you're interested, if you're a musician or an artist and you're thinking, wow, I might want to do arts and health, there's a summer arts intensive at the University of Florida in June, which is one of the epicenters of arts and health in the United States. The other one that I know of being UCLA. And then let's see, what else did I share down here? Oh, I tried to share, I shared my website, but the resources page is just, if you go there and click on resources, it's music and health. There's just a ton of stuff out there. I just added something yesterday. There's an organization called Tinderbox in Scotland. And I wish I had time to share this one video. You know what? I'm going to put it in the chat. There's this little boy, he's like 8 years old, talking about the impact of these musicians coming into him in the hospital. And they show this clip, which is obviously pre-COVID, of him conducting. Like, they had these musicians there. He looks like he's 6 and he's like going like this and they're all getting loud and he's going like this and they get soft. And it's like, what an empowering thing to give to somebody You know, I mean, especially in the hospital, you can't control anything that's happening.
Yeah.
You know, that's another thing I meant to mention. So I'm glad that came up. But
We have time if you want to show it, if it's not too long. Wendy,
oh, that interview?
you want to show the video?
I could. Should I
Yeah,
take
go
a
ahead.
moment and do it? All right. Okay, hang on. Let me just pull it up here.
I was just going to mention while you're doing that, with
Yes.
Arts for the Aging, we at times would have, before COVID, say, volunteers coming with us. So maybe that's something, if you have an interest, anyone out there could reach out to Arts for the Aging, and or maybe even over Zoom, who knows, that might be possible. But definitely when, you know, eventually say we are in person, because we did have that, and you get to see how you can work with art and share your talents.
So a related organization like that is timeslips.org, which fosters creative conversation and interactions with the aging, with people of all generations. And they have all kinds of activities and trigger questions that help people connect and open up. And that's something people could do now via anything, letters, phone, handwriting, Zoom.
Mm-hmm. And I'm also working with ArtStream, which does theater, and they are always looking for people to be mentors. So if you're interested in theater, you can be in the show with these adults that have intellectual and developmental disabilities. And, you know, you might get paired up with an actor or just kind of be there as a support person for them.
Yeah, they do great work. I did a documentary film project on them when I did a course with Docs in Progress. So I was assigned to ArtStream. They were great.
All right, well, listen, I'm going to show you this interview with this little Scottish boy. I mean, he's got a Scottish accent. He's so cute. Okay, here we go.
Well, Jed and Mike basically just came over to hospital when I was having an operation, and then they did an activity, and it was really fun. It was basically like making a piece of music up, and then my mum said that I played another musical instrument, and they said that if I wanted to, I could come along, and here I am. When I first arrived at Tinderbox, I felt really excited and happy, but also a bit nervous. But when I started doing all the music and stuff, we got to know everyone, I started feeling a little bit better. We've been here for 3 weeks, and we've done lots of good things, like we've watched 2 really cool films about like summer in Scotland, which is about a dog and a girl, and then we've also watched Changing Perspective, which is about a boy who's getting bullied and they have to try to overcome it. And then we've come up with some really great ideas of how we can like make some music up for them, and it's really fun. Playing at Tinderbox really has changing my perspective on music, because now I know how to like play with friends, and instead of playing on your own like you do, it's a bit boring. Now that I play in an orchestra, I'm finding it really fun, and I probably want to join more orchestras in the future. Well, I've been in hospital for like half my life. Well, it basically just makes me forget about what's happening in the world. Like, say I'm having an operation and then someone invites me to play music with them. I basically forget I'm having an operation.
Yeah, I mean, man, there's so much good stuff going on out there. It's really inspiring. So, do you all have any other resources you want to share?
Yeah, I just put some in the chat box. Well, time slips you already had. The Arts and Humanities program at Georgetown Lombardi not only has a free weekly email newsletter, but they offer a lot of free classes, online classes. There's expressive writing, there's arts, crafts. There's what else do they have? Yoga. In fact, I was playing for one of their yoga classes tonight, right before this. The yoga class is geared to to healthcare workers, but anybody can join in. So the information is on their website for those. On Facebook, the organization I'm certified through, Music for Healing and Transitions, they have every Thursday night, they have live music from 8 to about 8:20. They call it Thursdays with Therapeutic Music. And then they archive it, so you can, if you just want a little mellow music anytime, you can go to their Facebook page. And then there's a local meditation group. They do meditation twice a month on Saturday, and then Wednesday nights yoga nidra with Diana Woods. It's called Spirit First, and they have a meetup. So, and I put Willow Street Yoga. That's not free, but it is a great local resource for those of us in the Silver Spring area, Tacoma Park. For these things that are online, though, people are attending worldwide. I mean, it's astounding. People are finding them from all over. And I think one of the things we have all discovered as we've gone online, it's not going to go away once we're in person again, because it's made a lot of things accessible to people that were not accessible before. And I can't overstate that. I mean, it's really it's a humanitarian accessibility issue. You know, people who are in isolated places, or they don't have any money, or they can't travel, or whatever reason, these classes and music and movement are now opening up the world to anyone with an internet connection.
Yeah.
True, it's incredible, really. And like you said, it's going to keep
For
going.
you, Wendy, I focus primarily on veterans. So the music, the Warrior Music Foundation.
Oh yeah,
is a great organization that does it teaches veterans music, different instruments, and lessons for free. So they're like in Millersville, but Warrior Music Foundation, yeah. And yes, I saw the one question about cheerleader. What I would suggest is they're always looking for guides at Musicians on Call, and you could introduce the musician by being a guide, and you get certified through the hospital, and that would be great way to be part of a program to provide the healing power of music. Oh, yeah.
Once we're in again.
Yes.
I'm not sure who was the cheerleader, but
Ken Roseman.
oh, Ken. Okay, yeah, for sure. There you go.
And if anybody has any questions, feel free to put them in the chat. We're down to about 10 more minutes. There's another program now in the military called Creative Forces. Are you familiar with that, Steve?
I'm not. So,
Yeah, it's Creative Forces. It's NEA, and it's Military Healing Arts Network. So, and there's a link from my resources page. And there's a lot of links on there, yeah, that are of free tools, games. I don't know if you've heard of paint.team, Marcie, but there's this way that you can go online. It's kind of like a coloring book, but a little more free, and you can collaborate in real time with other people. Yeah. So that's on there too.
Anyway, I've started to get involved with more of the teaching artists of the Mid-Atlantic, and you all might be interested. Also the International Teaching Artists Conference, and now they're year round, and that's pretty interesting as teaching artists, just to find out what they're doing in other countries and other areas. So there's something I was just going to mention. If anyone has an interest in maybe pursuing working with seniors, I remember when I started, and back when I told you all about, Karen and I were in this program, Artists in Healthcare, and somehow I got to be working at Arden Courts. And at that time of my life, it was like kind of tough. But when I went in and worked with them, it was like another world. It was like humor. And my parents had died like several years before, so I missed that generation. And so that was kind of my start with working with seniors and seniors with dementia. And it was wealthy. I mean, it was just, I really benefited by that, not knowing what to expect, but just going for it. And, but just, sense of humor, always also just to be being present, that was it. But anyway, so if you have an interest, it was like, that ended up being really kind of cool, this whole sense of humor, and you're not focused on what's going wrong with your life, your world, you're in their place. And it was, so I just wanted to share that.
That sounds great.
We haven't really touched on this, or we did lightly, but when you're dealing with people who have memory issues or dementia, or they might have issues on speaking, like after a stroke, familiar music, the brain, music activates both hemispheres of your brain in many places. And even when people have lost the ability to talk, to speak, either because of Alzheimer's or a stroke or whatever, they often can still sing lyrics to familiar songs. And familiar music can help create new neuroplasticity that can help be an important part of people connecting. There's a great movie called Alive Inside. You can watch it online, where a guy who takes familiar music on little headsets to seniors, and just the transformation that can bring about for people.
I think I've seen at least a clip from that. And here I'm putting it
Alive Inside.
So we remember. Yeah. If you look it up on Google it, yeah, it's very easy to find. Steve, there's a question for you. What kind of genre of music do you play? And actually, when you were describing the nurses dancing, that's what I was thinking. I was like, what music made them dance?
Yeah. So, I would say mostly in the hospitals, it's 50s, 60s, 70s, so, sometimes I'll go a little more recent with, some of the younger staff members, but most of the folks that are, having some struggles just because of, age and things, that they're going to be in that kind of range of a genre of music. So,
well, can you give an example of like a song or two?
And maybe you should play a little bit.
Yeah, maybe you should play and we could dance.
So here's probably one of the most popular songs at the VA hospitals. How about that?
Excellent.
Well, I know it's kind of late. Hope I didn't wake you, but there's something that just can't wait. Hope you'll understand. Every time I try to tell you, the words just came out wrong. But I have to say I love you in a song. I love you. Yeah, so yeah. Yeah, so just stuff that has that connection. I think that's what we try to do. And once you can find out, I usually ask people what kind of music they like, and say country or whatever, and I go down those paths and do that. Yeah.
I have to share a story. Early in the pandemic, I was coming out of the dialysis unit, which is kind of in a different part of the hospital. I don't know if you've ever been to Hopkins, but it's just huge, And there was a woman sitting at a reception desk right outside the unit, and I was like, "You want to hear a song?" And I had "Lean on Me" in my head, and I started singing Lean on Me. And there was this like proscenium type door that doesn't have a door in it. You know, it's just like this opening into the adult dialysis ward. It was like a nurse, it's like sometimes in our lives, you know, this nurse came out and then another one came out. It was like, I would say 6 or 8 of them. And they're all, it was like the dialysis gospel choir. And my heart was like, I was like, oh my God, I hope I don't forget the words. You know what I mean? I mean, they would have been okay. I mean, they would have carried it.
Yeah.
But
They
it
had
was
you covered.
really, he did. And I was just like, so just like heart thumping after that. Like, wow, they really needed that, because it was just at that time when they were just getting slammed, you know? Oh man, that was really powerful. Really was.
Wendy, you
And-
should
and,
sing or play something for us too.
maybe we should do Lean on Me.
Okay.
That's a hospital #1. I have to say, that's one of the ones right up there,
So if I could
especially for the nurses.
I was gonna say there's another instrument that I play, which is a tongue drum.
Yeah.
And it's like a
Barbell.
steel drum with a mallet, like a rubber mallet, and it's got that kind of gentle. It's got a similar vibe to the dulcimer. It's not as like sort of specific with strings, but I did do that in a post-op, and the nurses were like, "Oh, I feel like I'm in a spa. You know, could you come every day? You know."
Yeah.
Let me
Wendy,
see.
Barb had a
But
Barb
I'd like to
had a
add something,
question.
if that's okay. This has just been fascinating. I'm a dance teacher. I run a dance company called Dance in Time, and I have a page on dance and health. You know, I remember when the first study came out in the New England Journal of Medicine about the study where they had people do a bunch of physical activities and found that the only of the physical activities that assisted with lessening dementia was dancing, presumably because it also has a big physical and social component. But anyway, the idea of doing things, not just for the people that are sick, but for the caregivers, I think is really powerful. I cannot tell you how many of my students over the years have told me that my dance class is their therapy. So, you know, I don't think you have to be ill or elderly to find that there's something enormously uplifting about this. And I commend all of you for the work you do.
Well, thank you. Thanks so much for being here. That was a great thing to hear. Yeah, everybody's doing good work. Hey, should we sing Lean on Me?
Yeah. That's a great way to end this, actually. We can go through this together.
And you know what? You don't have to put yourself on mute. I don't care. Sometimes in our lives, we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong. I'll be your friend. I'll help you carry on. It won't be long till I'm gonna need somebody to lean on. That's it. All right, people.
That's a great way, great ending. Yay, Wendy, wonderful job. Thank you for moderating and Lisa for having us all.
Oh, thank
For all you
you
do,
guys.
what you do. Thanks for
Thank you,
everything.
Wendy, Marcie, Karen, and
Passion.
Steve. It was really, really meaningful program tonight. And I hope we can all, it has a ripple effect, and we can all take what we learned from you to help the healing process through the arts. So
And I really hope that people take advantage of some of these links and resources, because there is a lot out there to see us through to the after time.
I'd say you save the chat, everyone.
save
Yeah.
your chat, because
I hope I can. How do you save your chat? I do not even
To
know.
the right, it's you open chat, and there's 3 dots to the right at the bottom.
Oh yeah, save the
Save
chat.
chat. All right. Thank you, Marcie. Zoom experts. Okay.
Okay.
Thanks, everybody.
Cheers,
Have a
Thank
good
you.
night.
Bye.
All right.
Thank
Good
you,
night.
everyone.
Good night.